There are two main types of trephidations. First one we call craniotomic, otherwise we call it elastical trephination. We can call it curative or radical trephination. And all these terms will be true and will be the synonyms. Once again, cranioplastic, craniotomic, curable, or radical trephination. What does it mean? It means that this surgery needs to open cranial cavity to remove some radical process, complete removal of some radical process. For example, to open cranial cavity to remove hematoma, or to remove tumor, or to make plastical reconstruction of the ventricular system. For example, there are hydrocephaly or some inborn malformations of the skull. So you see, I make the surgery to radically treat the problem. We can say that after my surgery, the person will be absolutely healthy. Because I will remove the cause of the disease. It is understandable, but let's say, in that case, my trephination will be only surgical access. Before this access, I must make 100 different types of the surgeries, which is radically remove the process from the head. And they will be different. One technique I will use for tumor, another technique I will use for bleeding, third technique I will use for plastical reconstruction. Let's say my trephination, it is excess. Now let's come to second type of trephination, which is called osteoectomic or decompressed or palliative. So all the names can be used. I think the last name will help you to understand what does it mean. Palliative surgery. Maybe Frank, you will try to help. What is palliative surgery? Brilliant answer. Maybe you? You start very well. Can you continue? No? Maybe you? Special. Brilliant answer. Please.
To remove the symptoms for
palliative surgery, that is surgery which is decrease the symptoms but doesn't remove the cause of the problem. Generally, palliative term is used not only for surgery, as we know. It can be used for medicine, which is treat the symptoms but doesn't remove the cause of the problem. Yes or no? Thank you very much. Great answer. That's a palliative surgery, palliative trephination, make one thing: decrease the pressure inside of the cranial cavity. Remember loudly, please. It doesn't remove the cause of the problem. For example, tumor. No, it just decreases the pressure inside of the cranial cavity. Okay? Let's say, can I say that it is only excess? It is everything. It is an excess and technique and everything. Because after the formation of this aperture, I don't do anything else. I suture the soft tissues and grow. And so, do you see some big difference between radical and between palliative? Difference not only in meaning, difference of the technique. In one case, it is just only access. Door is open. I come to the room. I God's know for what. I come to teach you. I come to write. I come to work in computer. This is comparable what I want to do. But by surgery, it is only opening of the door. Second situation, I open the door to make the refreshing of the air. Let's say my opening of the door, it is under access and all necessary manipulation which I need to do. I will not come to this room and do anything else. Do you understand it or not? Let's say this is two types of trephination. Let's continue. Now write please the craniotomic or curable, or we can say radical trephination. Now look, I told you that I made this surgery to remove some problem. That's why, of course, place of my surgery will be connected with the place of location of the problem. It will be just above location of the problem, maximally near of it. Sometimes it's impossible to do exactly above because there are some important structures which we can damage, for example, sinuses. In that case, I will find maximally near place, yeah, and to avoid the formation of problem, but at the same time to open the problem, which is been done. But one, we need attention. Can I say the same for the compressive definition, that the place of its performance connected with place of location of problem? No, she is right. If I want to pierce the balloon, doesn't matter from which wall I will do it. Anyhow, air will come to our side. Will I do it from up, or from down, or from side? Let's say in case of the compressive one, I must find one most easy and less dangerous place. And it will be the best one. But I cannot do same for craniotomy, can I tell you? Because sorry, if problem located in occipital region, and most comfortable place for this frontal region, it will not give any result. From frontal access, I cannot remove occipital problem, and vice versa. Do you understand now the difference between that? But for the compressive one, the best place, it is your temporal region. 3 reasons why. Reason number 1, keyboard. Reason number 2, no any sinus. Reason number 3, big muscle which will protect it, is aperture, and which will absorb the liquid which will come to outside. Why you make the injections inside of muscles, not in the fat? Because muscles can absorb the liquid, they have a lot of vessels. Fat no. If you will make, for example, injection in the gluteal region inside of the fat, by majority of the cases it will form abscess. Post-injectional abscess. Why? Because the medicine will not be absorbed, guys. It will be accumulated in the fat. Because fat doesn't have so good absorptional index. But muscles have. Peritoneum have. If you will make injection inside of the peritoneal cavity, it will be equal to injection inside of the vessels. Because the score of the absorption is very high. That's why peritonite, it is equal to sepsis. If there are the pus inside of the peritoneal cavity, after a few minutes, it will spread into the vessels. Because the peritoneum can absorb it very quickly with all the liquids. Remember well, because it is not the cranium, but it is medicine. Let's continue now about technique of craniotomic trepidation. As it's written here, there are 2 main techniques: single flap and double flap method. What does it mean? I can open the cranium by formation of one flap, which will contain everything from skin up to bone. By author, we call it the Wagner-Wolf method. Or I can do something like this. Look, soft tissues is for one flap, bone is for second flap. That's a so-called double flap method, or we call it Oliveira method. So remember this, we can have single flap, we can have double flap. By the way, guys, don't ask the question like what is the better. If we will have something worse, we will not use it at all. So comparable with the situation, each method has advantage and disadvantage. What is the main advantage of single flap method? You don't separate tissues to each other. Let's say healing time will be shorter, regeneration will be better, traumatization will be less. But in the same time, it has some disadvantages. This is very hard to cut the bone with non-removed soft tissues. Then you just make this manipulation inside of incision. You don't have enough the field of the surgery. Let's say it is technically hard. Functionally better, but technically hard. That's why if it is an emergency case, you don't use it. Because you need the long and you will use double flap method. What does it mean? Firstly, you will separate soft tissues. You will open the surface of the bone, and then only you will start to make the bony disconnection. Idea is understandable?
Yes.
So let's start to speak about double bone flap method, two flap method. Single flap method is absolutely same, only one is difference. In case of double flap, then you reach the periosteum, you disconnect it bluntly, these layers from the periosteum and bone, and turn it to down. In the case of single bone flap method, you don't do it. Your assistant maximally by hooks enlarge the incision, and you start to make the perforation of the bone through the incision of the soft tissues. But anyhow, doesn't matter, single flap is it or double flap is it, base of the flap should strongly look down. Why? Because all nutritional vessels in the head region pass from down to up. So if you will not keep the base in inferior portion, for example, if you will make flap like this, bases look to upwards, nutritional vessels will be cut. Idea is understandable for you. Okay, now what we are doing. Usually, guys, in temporal region by direction of superior temporal line, in another regions in another direction. Again, I say, according to the place of your surgery. Anyhow, you cut soft tissues, and you make first flap content from skin up to muscles, but not periosteum. Periosteum also soft tissue, but it's not included in soft flap. Okay, anyhow, the bone is open. Now, usually, here is written to show that it is, I don't know, so fantastically by Lazarus cutting. We have special lasers which can be used. But usually we don't do it. We make the drillings, usually 5 apertures. 2 in the base, 2 in the sides, 1 in the tip. We clean the periosteum between the apertures. Now by Gilly saw, we start to cut the bony tissue except the base. Base we cut only from the inner side, internal tapered layer. By the way, periosteum is not cleaned also in the base region. Then you take the elevator, it is special metallical instrument. You insert it in between bone margins and you break the base of the bony flap. You break it. You don't disconnect it completely because periosteum not covered. Let's say it's also turned to that. It is understandable. Surgery is finished, guys, because I make only excess. What will be happen after in cranial cavity, I don't know. Comparable with situation, I can arrest bleeding, I can remove the tumor, and yeah. But now let's come to the second surgery, which is the decompressive or cranioectomic definition. Here, as I said before, we choose best region, which is temporal. And how we do the surgery? Usually incision it is vertical descending, not horseshoe shape. You cut skin, fatty tissue, superficial and superficial, and you see muscle. Muscle we try to not cut, we split it by direction of muscular fibers. Look, muscle can be cut or muscle can be split. Splitting is much more better. Why? Because vessels in nerves doesn't damage. Under the muscle, you see the periosteum with the bone. In mid-side, you clean the periosteum. Samely, you drill the bone. Then you take the Dahlgren forceps and enlarge aperture up to 3-4 square centimeters. Then you will remove the bone. You will see protrusion of the dura mater to one side. Why? Because there are high intracranial pressure. If you cut now dura, brain will be inclinated in the aperture, will form the hernia, will be pressed and damaged. Let's say before cutting of dura, make the lumbar puncture. Decrease the pressure inside of the cranium, you will feel it. Dura will go to the exit. And only after cut the dura. Usually we cut it in crisscross direction. Why? Because in the future liquid should come towards. Surgery is finished, now I start to suture. I suture the muscle, bone is not replaced, of course, anyhow. I suture all soft tissues, nothing. Plastical reconstruction, guys, it's very simple. There are 3 main methods, 4 methods generally, but one is not used. It is autoplastical methods, then you take the bone from same body. Usually it is ribs or it is iliac bone. You can take the piece, form the some flap, and close the defect. Great method, doesn't give any autoimmunity reaction. Second method, it is heteroplastical method, usually cadaver bones. Today we try to not use it. A lot of immunity reaction. Method number 3 generally is not used. It is xenoplastical transplantation, animal bones, awful reactions. Most useful method it is alloplastical method. Then we use usually non-organical material. For example, mechanical shields, as you can see. They can be inert like the titanium, and they can be filled forever inside of the body. If it is stainless steel, usually after 2-3 months, we remove it because the regeneration is happening. Do you understand me or not?
Yes.
About anatomy, I say everything in my previous class. Remember Shippo triangle? Inside of Shippo triangle, we again drill, we open the anthropostomy there, we make the drainage, the cleaning, everything which is necessary. Again, for adults, defect is closed after 6 months, like in any resection or termination. For child, after 2 months. That's all. Questions? Let's relax a little bit. After 10 minutes, 20 minutes, you will go. Okay? Very well. I do my work, guys. Now I will be happy if you will have questions. If you will not have questions, why I need to confuse you? To ask the questions and then remove you from my class. Much more better to relax. Okay?
Is it this?
Yes. I have.
This, the person has to be careful, like, because